Hello friends, my name is Miraj and today I would like to discuss about mucormycosis, which is also called as black fungus. So let's start this video. What is mucormycosis? Mucormycosis is a serious but rare fungal infection which is caused by a group of molds called as mucormycids. These fungi live throughout the environment, particularly in soil and in decaying organic matter such as leaves, compost piles and rotten wood. People get mucormycosis by coming in contact with fungal spores in the environment. For example, the lung or sinus forms of the infection can occur if someone breathes in spores. This form of mucormycosis usually occur in the people who have health problems or take medicines that lowers the body's immunity. Mucormycosis can also develop on the skin after the fungus enters the body through a cut, scab, burn or other type of skin trauma. Now let's talk about types of mucormycosis. First is rhinocerebral mucormycosis. It is an infection in the sinuses that can spread to the brain. This form of mucormycosis is most common in people with uncontrolled diabetes and in people who have had a kidney transplant. Second is pulmonary mucormycosis. It is the most common type of mucormycosis in people with cancer and in people who have had an organ transplant or a stem cell transplant. Next is gastrointestinal mucormycosis. It is more common among young children than adults, especially premature and low birth weight infants less than 1 month of age who have had antibiotic surgery or medications that lowers the body's immunity. Next is cutaneous mucormycosis. It occurs after the fungi enters the body through a break in the skin. Last is disseminated mucormycosis. It occurs when the infection spread through the bloodstream to affect another part of the body. As we discussed about types, now let's discuss about symptoms of mucormycosis. Symptoms of mucormycosis depend on where in the body the fungus is growing. Symptoms of rhinocerebral mucormycosis includes one-sided facial swelling, headache, nasal or sinus congestion, black lesions on nasal bridge or upper inside of the mouth that quickly become more severe, and lastly fever. Symptoms of pulmonary mucormycosis includes fever, cough, chest pain and shortness of breath. Let's talk about cutaneous mucormycosis. It can look like blisters or ulcers and the infected area may turn black. Other symptoms include pain, warmth, excessive redness or swelling around a wound. Symptoms of gastrointestinal mucormycosis includes abdominal pain, nausea and vomiting and gastrointestinal bleeding. Symptoms of disseminated mucormycosis. It typically occurs in people who are already sick from other medical conditions, so it can be difficult to know which symptoms are related to mucormycosis. Patients with disseminated infection in the brain can develop mental status change or coma. Now let's talk about who gets mucormycosis. Mucormycosis is rare, but it's more common among people who have health problems or take medicines that lowers the body's immunity. Certain group of people are more likely to get mucormycosis, including people with diabetes, especially diabetic ketoacidosis, cancer, organ transplant, stem cell transplant, neutropenia, long-term corticosteroid use, injection drug use, too much iron in the body, skin injury due to surgery, burns or wounds, premature and low birth weight. How does someone get mucormycosis? People get mucormycosis through contact with fungal spores in the environment. For example, the lung or sinus forms of the infection can occur after someone inhales the spores from air. A skin infection can occur after the fungus enters the skin through a scab, burn or other type of skin injury. Is mucormycosis contagious? No, mucormycosis can't spread between people or between people and animals. How can you lower the risk of mucormycosis? It's difficult to avoid breathing fungal spores because the fungi that cause mucormycosis are common in the environment. There is no vaccine to prevent mucormycosis. For people who have weakened immune system, there may be some way to lower the chances of developing mucormycosis. Protect yourself from the environment. Try to avoid areas with lot of dust like construction and excavation site. If you can't avoid these areas, wear an N95 mask while you are there. Avoid direct contact with water damaged buildings. Avoid activity that involve close contact to soil or dust, such as gardening. If it's not possible, wear shoes, long pants and long sleeve shirt while you are doing these activities. Wear gloves when handling material such as soil to reduce the chances of developing a skin infection. Clean skin injuries well with soap and water, especially if they have been exposed to soil or dust. Let's discuss about diagnosis and also what tests should be done to diagnose mucormycosis. Healthcare providers consider your medical history, symptoms, physical examination and laboratory tests when diagnosing mucormycosis. Healthcare providers who suspect that you have mucormycosis in your lungs or sinuses might collect a sample of fluid from your respiratory system to send to a laboratory. Your healthcare provider may perform a tissue biopsy, in which a small sample of affected tissue is analyzed in the laboratory for evidence of mucormycosis under a microscope or in a fungal culture. You may also need CT scan of your lungs, sinuses, or other part of your body, depending on the location of the suspected infection. Mucormycosis is a serious infection and needs to be treated with prescription of antifungal medicines. Often, mucormycosis requires surgery to cut away the infected tissue or infected part. If you like this video, then share this video with your friends and family, and also don't forget to subscribe this channel. And thank you for watching this.